Hi, this is Dr. Kathy. Today I want to talk to you about potential side effects with the most commonly used ADHD medication, which is the stimulants. So this is the dexamphetamine family, which includes Vyvanse, and the methylphenidate hydrochloride family, which includes Ritalin 10, Artige, Rinodate, Ritalin LA, Atora LA, Rubifen LA, Concerta, Tiva, and the other extended release methylphenidates. So when we're doing a trial of stimulant medication, the big concern that most people has is that their child will be too flat. And I don't want a child to be too flat. We don't tolerate that. That is usually dose related. And when I'm talking through how to do a trial of medication, I usually give people the ability to titrate the dose. Don't be too afraid of going up if you're not sure whether or not your child's on enough, because if it's too much and they go flat, you just dial it back down again the next day. The long-term potential for side effects is twofold. And one of them is in growth because it reduces eating. And when we reduce eating, eventually it can affect final height. So when I'm measuring heights and weights, I've got to put them in my medical record. Unfortunately, with my medical record, I need the screen facing me. Otherwise, it doesn't let me type in very well. It can misbehave. And if I don't rotate and show it to you, please just remind me. It's not trying to hide growth chart from people. I just got an issue with the screen. So there's the growth, and there's a theoretical 2-point increase in blood pressure. Now, I need to put this in context. For most of the time we've been measuring blood pressure, we've measured it within a 5 milligram range. And now with the battery or electric machines, we can get a more accurate range, but there's still plus or minus in that. And 2 points really isn't statistically significant unless your child already has borderline or high blood pressure. And so that baseline high blood pressure is important, and measuring it from time to time. It isn't always the best time and place to measure it in my office, especially if we need to talk about difficult behaviour. Children don't like me to hear about bad behaviour. They're worried as to how will I respond, and they just don't like to hear it. And so they can get all uptight and anxious. So from them checking blood pressure, it can be raised. So if you're with your GP, that's a far better time to get that checked every 3 or so years. The sort of side effects we don't tolerate, and if they happen, you stop medication and you let me know straight away. So stimulant medication can help tics, so motor tics or vocal tics, which I'm not going to mimic, clearing the throat, vocal noises. It can help those. So tics are through anxiety. And with most children, when they can focus better, anxiety reduces. But with some children, if they've got a true underlying anxiety disorder, anxiety can get worse and the tics can come on. If they do come on, stop it, email. I've had children getting emotional on medication. Now, one 5-year-old boy burst into tears because with his first dose, they went down the street and finally he could read everything and he was so happy. One girl was distraught at school because finally she's able to focus enough on the subtle social cues, and she finally realised the girl she thought was a friend was actually a bully and was trying to provoke her into an outburst. And she was distraught. And one girl, she got angry with her brother and sister because finally she could hold on to a thought and then she could hold on to a grudge, and she had to learn how to forgive. So they're not medication side effect. This is now I can focus and I have an emotion. But children can get grumpy, moody, and if there's any doubt, stop it. Certainly don't put the dose up. I've had rare nausea, diarrhea, tummy pain like gastro, stop it. Is it your child or is it other children? If there's a fever or vomiting, it is more likely to be a viral illness or a urinary tract infection. If in doubt, get the urine checked, especially if it's a younger girl under the age of 9. But if you're not sure and they weren't terribly sick, then you can restart it once they're well again and see what happens. It is a rare side effect. Gastro is far more common. I've also had a couple of brief heart palpitations, a couple of children with dry mouth, and I've now had 2 children with leg spasm, and the leg cramping is related to reduced blood flow, so definitely need to stop it. So if there's any doubt, email me. Sometimes we actually need you to stop it and retry it and see, because it's not straightforward. But if you don't want to try it again, let me know. If a child is on methylphenidate hydrochloride, in other words, Ritalin 10, Artige or Rinodate, they're the current brands of short-acting methylphenidate hydrochloride, then Concerta, which is a longer-lasting, smoother on, smoother off version, can be tolerated. Because it drops down slowly, we don't get that getting emotional as it wears off. So it doesn't totally mean we can't use methylphenidate hydrochloride. It just means we need to get the right form. I hope that's helpful. Have a great day.